first item on the agenda, which is introductions. And so in no particular order, I'm just going to ask for those that are part of this meeting today to introduce themselves by stating their name, the organization that they represent, and perhaps a little bit about what your organization does. So thank you so much. So first, Tony Bruno.
Good afternoon. I'm Tony Bruno. I work for Valley Assistance Services. We provide wraparound services for seniors from basically Rio Rico, Arizona to Pima Mine Road in Sahuarita. And we do everything from housing assistance and transportation to RN advocacy in the community. Thank you.
Great. Thank you, Tony. And then Liz Rabago.
Yes, of course. My name is Liz Rábago. I am an independent consultant currently working with United Way with Spanish-speaking childcare providers. I offer digital and financial literacy programs for them and their assistants.
Great. Thank you for being here.
Of course.
Let's see. Kim Trevino.
Hi, I'm Kim Trevino. Work with Catholic Community Services of Southern Arizona. We do everything pretty much from womb to the tomb. We take care of childcare and preschool, down to our seniors and aging. And our tagline is we specialize in the marginalized.
Thank you, Kim. Appreciate you being here as well. Let's see. I'm going to ask for some grace on how to pronounce your first name. Is it Jaiza? Is that how you pronounce it? Did I get even close? I am so sorry.
No worries. Hi, everyone. I'm Hayaiza Quinones. I'm an impact and operations strategist with the Community Foundation for Southern Arizona. We are a public charitable organization that serves the entire Southern Arizona region through grant making and philanthropy. So happy to be here and thank you all for the invitation.
Thank you. Thank you for being here. Let's see. Carolyn Lewis.
Hi, everybody. I'm Caroline Lewis. I'm the Community Engagement Manager for the Pima County Health Department. We offer lots of services for community members, from clinic operations to mental health programming. WIC is under our department as well, so nutritional services for women and families and a whole other gamut of programs and services.
Thank you. Thank you for being here. And then Madeline.
Hi, everyone. I'm Madeline DeBloy. I'm at the University of Arizona in several roles. So I'm with the Community Research Evaluation Development Team. We've worked with a host of community organizations on evaluation projects. And I also now occupy the role of State Evaluation Specialist with Cooperative Extension. So Cooperative Extension being the most community engaged arm of the university. And I wear the evaluator hat there too.
All right. Well, great. Thank you so much. Thank you for being here as well. Let's see. Lisa Reams.
Hello, everybody. Lisa Reams here representing Pima Council on Aging.
Thank you, Lisa. I appreciate you being here as well. Let's see. Tom McKinney.
Hello, Tom McKinney, CEO of Interfaith Community Services. Happy to be here.
Thank you, Tom. Appreciate you being here as well. Lena.
Lena. Hi, everyone. Lena Perel, lead planner at the City of Tucson Housing and Community Development Department and one of the city leads for implementing the Prosperity Initiative.
Thank you so much for being here. Lisa Schaefer.
Hello, Lisa Schaefer, Town of Marana. I'm in the Community and Neighborhood Services Department, and one of the divisions we have in this department is our CDBG program. So we have housing rehab and utility assistance programs that we offer.
Thank you for being here as well. And then Cassie.
Hi, everyone. Cassie Lundeen, Pima County. I'm with the Community and Workforce Development Department, division manager, and I work with everything from homeless services all the way through workforce and early childhood education.
Great. Thank you for being here as well. Lisa Reams?
You already
I know
got
I
it.
already called on you, correct? Right? Did you have another person from your organization also being introduced today?
No, I don't believe so.
Okay. All right. Okay. Thank you. Let's see. Sure I'm not missing anyone. And then Lisa Florin?
I'm gonna say, did everyone see me jump every time Elisa was named and it wasn't me? I'm very Lisa heavy in this meeting today. That's great. Hello, Lisa Florin. I'm with United Way of Tucson and Southern Arizona. I oversee our financial wellness and housing stability and homelessness areas, and also am the chair for the Tucson Pima Collaboration to End Homelessness.
Thank you for being here as well. Right. I think that captures everyone that's on the call. But in case I'm overlooking someone on accident, if I have an extended opportunity for you to introduce yourself, please raise your hand through the little prompt at the bottom, and I can make sure I give you ample time to introduce yourself. I think I captured everyone. All right, sounds good. So we're going to move on to our next item in the agenda. And we're going to move to in-kind reporting. So regional planning efforts are enhanced by recording time donated by attendees, volunteers, and participants. PAG collects data on the time dedicated to meetings and activities to apply for use as matching funds for grants and federal dollars. If you're paid with federal dollars, whether all or in part, please let us know now so we can account for this appropriately. Time spent in preparation for this meeting will be estimated by PAG staff who are knowledgeable of the agenda and meeting materials. At the conclusion of this meeting, the session report will automatically calculate your time spent in this meeting. Time spent working on PAG or RTA initiatives, programs, and special projects may also be eligible for consideration for matching funds. So with that, if we could just do a quick show of hands of those that are paid through federal dollars. I see Tony, Lisa Reams, Cassie, Lisa Florin, Carolyn Lewis, Madeline. I think that's everyone. Did I miss anyone?
Can I just clarify that that's all or in part, like through federal grants?
Okay. All right. Thank you. And you can feel free to email me if you want to offer any clarification as appropriate, offline, so to speak, through email versus on the call right now. All right. Let's see. I think that concludes that. So we'll just go ahead and move on to the next item on the agenda, which is item number 3, which is regional need and fact sheet presentations. And I know quite a few of you had submitted some fact sheets that you might want to talk through, or presentation slides. So we're going to make sure that we account for enough time to get through those, because we also have other items on the agenda that we also need to allot the appropriate amount of time for. And we're trying to keep this meeting within the 2-hour time block that we've allotted for it. So let's see, I think we have a few presentations. Let me see, can we go ahead and put the first presentation up on the screen? I'm going to ask my team to do that. Thank you. All right, so for Pima County Workforce Development, I'm going to go ahead and let that presentation go ahead and get started whenever you're ready.
Yeah, thank you. So here at Pima County, for specific to our workforce development, we are federally funded by the U.S. Department of Labor, Workforce Innovation and Opportunity Act. It's a pass-through through the state of Arizona Department of Economic Security. Next slide, please. So essentially what we do is provide all things workforce regionally across Pima County. We have 2 comprehensive sites, 2 specialized sites focusing on veterans and opportunity youth. And then we also have satellite locations in Sahuarita, Marana, Far East, as well as in Ajo through our ISDA partnership. We are in libraries, we are all over the place. So there's a one-stop person available and ready to help. We do so with our resource navigators, our business services team, and professionals we call case managers. But essentially, everybody who comes to the door or looks at the website can access any one of these services for job support, job search assistance, as well as training discussions with staff. So even if we don't pay for it, we're able to connect people to higher education or industry recognized credentials. The charts that I'm displaying is essentially a 4 to 5 year overview. So you can see the volume of people that we serve throughout the years. Program years begin July 1 and end June 30th. And it just varies, depend on the services that they come in seeking. Next slide, please. The individuals we serve come to us with quote unquote barriers or characteristics that are managed or targeted under the grant. So as you can see, we have a 26 to 49-year-old population that we predominantly serve. We have the same demographics throughout Pima counties. We're very aligned to our population regionally. The characteristics, it ranges from foster care youth to displaced homemaker and everything in between. Predominantly, low-income individuals are the individuals we serve under the grant. These are just grant eligible participants, so it's not inclusive of the total 15,000 people that we support and aid throughout the year on a regular basis. Next slide, please. When an individual is eligible for grant services, we're able to provide what we call intensive or individualized services. Essentially, we're able to pay for supportive services, training vouchers, incumbent worker training, on-the-job training, work experience, transitional jobs, apprenticeships, and occupational skills training. That's a lot of heavy federal lingo for, we just help them reach their career goals. Next slide, please. As you can see, our funding is broken down into several subcategories, with adults, which is essentially anybody over the age of 18. Dislocated worker is an individual who is laid off due to no fault of their own. Youth is an individual who is 14 to 24 who is either in school or out of school. We have our rapid response, which is essentially when a company comes in, they reach out to either the state or in Pima County to CWD, letting us know that they're either going to close the business or they're going to lay off some of their workers, and they want to connect them to reemployment as soon as humanly possible. So we go in, we do a comprehensive case management connection and resource session with these individuals to get them connected to all of the unemployment resources as well as other jobs as needed. So we have various funding streams, and you're going to see from the height of the pandemic, we were at about 10, almost $11 million in Pima County that we were able to allocate and dedicate to the individuals with barriers seeking employment, to 6.2 million this fiscal year. And we're just anticipating additional reductions in funds, which is limiting the number of people that we can actually put through training, provide those supportive services like tools, books, and whatnot for training. But in addition to that, childcare assistance, as well as rent and utilities, car repair, and whatnot. So that's kind of where we're at over the past 5 years. Next slide, please. And of course, as a federal grant program, we are incumbent on reaching program outcomes and goals. So we track individuals. So once they exit our program, they have a full 12 months of follow-up. And so they still have access to their individual case manager, professional services, access to additional resources. If we can't cover it under our workforce program grant, we will leverage all of the partnerships and other community-based organizations in town so we can get that individual supported as quickly and as soon as humanly possible. Next slide. Or is awesome. That's it for me. Any questions?
Does anyone have any questions on the presentation before we move to the next one? Let me see if I see any hands raised.
Yeah.
I see Lisa's hand up.
Yeah.
Lisa's hands up. Yeah.
I was just going to point out that, yeah, I think the slide that had the funding was really helpful because I know that's something we were especially interested in today. So seeing that even over like last year, it looks like the funding is down like close to like 25%. So yeah, just wanted to highlight that. So thanks.
Thank you. I appreciate your investment and time putting this together. I think this is really helpful information for our discussion today. All right, could we go ahead and put, I'm sorry, go ahead.
Oh, I was just, thank you guys for allowing us to present.
Yeah, you're welcome. Thank you. See, can we go ahead and put the next presentation slide up? Great. All right, so for the presentation on regional need for interpretive services, I'm gonna go ahead and let you go ahead and start whenever you're ready.
Okay. I personally do not like doing presentations, so bear with me. The regional need for interpretive services, Catholic Community Services, we do that. We offer interpretive services for the deaf, blind, and hard of hearing. Next slide. To identify the need of interpretive services, which obviously you're going to see there's a great need for it if we have 1.1 million Arizonans that have hearing loss. 30,000 people in Arizona are culturally deaf, which means they identify as being deaf or have some hard of hearing. 1/3 of Arizona seniors now have hearing loss, and 25,000 Arizonans are culturally deaf as of the last one. Next slide. Now, here's the problem. With 1.1 million people being hard of hearing, we only have 74 people that can interpret legal jargon for them. There's only 917 Arizona general interpreters for 1.1 million people who are hard of hearing. And we have provisional interpreters, which are people who can help them with like their medical, just like the basic things, so certain provisions. But for general interpreters for 1.1 million, 917, obviously it's showing there's a great need. Next slide. Considerations in communication. Obviously, ASL, American Sign Language, would be the first choice. And the reason we prefer that choice is because it gives them more input in what they're doing and how they can make decisions and being able to self-advocate. It gives them equal access and effective communication, and it helps the unique culture and the needs of people with a wide range of hearing levels. Because some people are hard of hearing, but they're not completely deaf, so they don't embrace ASL until they need it. There's also American Sign Language interpreter licensure laws. The interpreter cannot do certain things like make recommendations for them to sign anything. Sometimes they can't, interpret anything medical. They can't be privy to like their pharmaceutical needs because of HIPAA violations, and they can't give any legal advice. And that also comes with the applicability of ADA in Section 504 of the Rehabilitation Act of 1973. So those people who do interpret, they are held to a standard. Some people do use auxiliary aids, assistive devices, cultural factors, communication techniques, which may differ person to person and culture to culture. And what we do is we try to make everything as an available resource to them. So if this don't work, maybe this like protactile will work, or if this doesn't work, maybe this will work. Next slide. To communicate. Probably most of us don't have ASL skills, or we have very limited ASL skills. So to be able to communicate with somebody who's deaf, especially if you have them along your routes, these are some other ways we can do this. get the person's attention. For a deaf or hard of hearing person, a wave from a distance or a gentle tap on the shoulder is sufficient. Obviously, you can talk as loud as you want. They're probably not going to hear you. And you don't want to startle somebody because especially if you're compromised with your hearing. Face the person when speaking. Speak to the interpreter. Do not face the interpreter or the person's companion. And that way they feel like they have a voice, that they're being self-represented. Be cognizant of having one person speak at a time, because for some of them who are just hard of hearing, it sounds like just a bunch of mumble jumble if more than one person speaking. They may be able to read lips or follow along with some gestures, but if there's multiple people speaking, it's just jarble. Speak clearly and at a natural pace. Write down key information or key words if it appears the person does not understand you. And of course, when in doubt, pull the pen and paper out and just write it down. Communicate the best way you can. Unfortunately, most people who are born deaf have about a third grade reading level. It's very odd that they have a higher reading level, so you want to keep it as basic as you can. During the conversation, and you've seen them interpreters at like concerts, or you've seen them at sporting events, and you're like, they're very animated. There's a reason why. During the conversation, use your facial expressions and gestures. Expressions and gestures help fill in the gap or help with the intention of the message. That's why they're so animated and so over the top when they're signing. Maintain eye contact, because eye contact facilitates direct communication. And when I'm speaking to you and you're hearing, you appreciate when I look at you when I'm speaking, just as they would as well. Be aware of light sources, windows, or other bright light sources, because they can create shadows on your face. And this can make watching your face or trying to read lips or watching any type of signing and facial expressions difficult for them to read. And of course, complex communication requires a licensed ASL interpreter. So if there's a more in-depth conversation you need, you have to provide a licensed ASL interpreter. Next slide. What we do at CCS is we advocate for the deaf and hard of hearing community. We inform members of the deaf community about rights, laws, and programs available to support or become self-advocates for themselves. We provide resources, maintain an extensive list of resources, and make connections to services that improve the quality of life for the deaf community, such as the 5310, which improves their quality of life where they can get to places where they wouldn't be able to go. Consultation, work closely with other community entities to improve the quality of life for the deaf community and determine gaps that need to be addressed to better serve the deaf community. And with that consultation, we have a deaf board. So they come together for town hall meetings, and they want to address what they see as problems in their community. And we have those 4 times a year. We also provide education in-house and out of the house outreach. Provide valuable outreach and educational opportunities that educate about the deaf community, such as American Disabilities Act, civil rights, deaf culture, legal issues, fraud protection, and other topics and concern as determined by the deaf community. And we're hoping in 2026 to open that up to the community so they can come in and have that experience. Next slide. And that's all.
Thank you, Kim. It's just going to open it up to questions. I did have one question. If you could just share with everyone what is meant by culturally deaf, just in case anyone's less familiar with that term.
Culturally deaf is people who identify as being deaf or in the deaf community. So that could be a spouse that's deaf, but their partner is hearing. So they will assume the role of being culturally deaf because they're in that community.
Okay, thank you. That's helpful. Any other questions for Kim? Lisa, go ahead.
Yeah, that was great. Thank you, Kim. There's a lot that I didn't know about what the need was in Arizona. I am curious, can you expand a little bit more on if there have been how funding changes might be affecting some of your programs right now?
Oh, well, as a whole, funding changes are affecting all nonprofits. We're not the exception, especially in things that are with disabilities and people and abilities. that cutting has been reduced significantly. And we've also seen like our housing for those communities be completely pulled. We've also seen DEI initiatives written into new grant proposals. So it's a pretty trying time for all nonprofits, and I think we're not the only ones affected by that.
Yeah, thanks. That's a really good point. I think that a lot of these programs probably have historically fallen under like the DEI and IDEA like funding streams. So thanks for bringing that up.
Kim, do you have any numbers that you could share in terms of like what the average cost of ASL interpretive services is per individual? I guess perhaps is one way to frame it, just so we get a sense of that a little bit.
There's multiple avenues you can take with that. I know like under our SSP program, we charge the state $75 and $85 an hour.
Thank you. I appreciate that. Does anyone else have any questions for Kim? All right. Thank you, Kim. Appreciate your investment of time putting that together.
No, thank you.
All right. I know Tony Bruno was going to do a verbal presentation, I believe. I don't believe Tony had slides necessarily, but Tony, were you still going to give a verbal presentation today?
Yes.
Okay, great.
So as I said earlier, Valley Assistant Services works primarily with seniors. And I just wanted to talk about the cuts that have affected seniors directly. And when we talk about basic services for the community that we serve, if emergency food and shelter program is gone, we have 7,700 clients that we serve. Without that funding, we cannot provide any support to those who are homeless or about to be homeless. That effect has actually happened statewide. We now get phone calls from across the state. We've had folks asking for help from as far away as Flagstaff and willing to come down south to Green Valley, seeking help with housing. The other piece of that is with the homeless population in Tucson being asked to vacate or move into specific areas. We have seen an increase in homeless populations within our service area, and being able to help them has become very difficult for us when we were able to do that before. And it just kind of reflects, as was just said, the cuts that we all are feeling. We have seen a loss of community service block grant funding from the county and from the state. We have seen a loss of HUD funding directly affecting basic needs. We provide 2 programs down here for workforce development. We are a SNAP CAN provider. SNAP CAN is what folks who are going to get food assistance or be on SNAP must complete under the new federal regulations. We are about ready to initiate that program to support those seniors. We do receive 5310 funding also. Health benefits have been a problem for the seniors down here. And what we see primarily is if the rural folks and the rural seniors don't have the transportation they need to get to doctor's visits, they don't follow up and they're not as healthy. And so what we're looking at across our almost 2,700 square mile service area is seniors being left out. We know that the rural seniors are in even worse shape because of this. And I just have to say what we do touches about everything that this money touches that we're talking about. And how we all work together with those funds to check all of those boxes off. And I know that's a lot of boxes. Um, and I know numbers are very different, whether it's Tucson or other areas. And so I just want to say that partnership anymore has got to be key, not just funding. And so my piece is just an overarching briefing of numbers and losses and partnering, because those you can't help come our way and those we can't help go your way. So there's got to be a better way to do things amongst ourselves. And I know we don't really have control over the funding here. Thank you.
Thank you, Tony. Did anyone have any questions for Tony before I move to the next potential presentation? Gonna see if I'm not missing anyone's hand up. Oh, I see Liz's. Go ahead, Liz.
Sorry, I was trying to look for the hand. So Tony, when people reach out to you, like from Flagstaff, are you able to help them or to serve them, or you just deny services to you? Give other resources, and are your resources only for the Sahuarita and that Southern Arizona side of the state?
So I'm glad you asked the question. Our funding is pretty restricted because it's all grant money basically, and it's restricted to our service areas. However, we get some money from a couple outside places that we can use. And we do support folks in Tucson. We've supported folks in Nogales. We are in the process of rewriting our resource manual for our reception folks and our case managers so that we can reach out to other areas in the state when they can't find the help they need. We recently redid our 211. I don't know how truly helpful 211 is in the long run, but we try to use that also. And if we can help, we will. The idea is not to let anyone hang.
Thank you, Tony. That's a good question too. So thank you for asking. Any other questions for Tony? Looking for.
I would just add one other thought,
Yeah, go
maybe.
ahead. Sure.
For those who live in our rural region, and we go out to Arivaca and some further out places, when we talk about distance for rural folks, and we talk about our 5310 vehicles, we actually travel 200 miles for one client to get to a doctor's appointment in Tucson. So it gets pretty intense when we're dealing with some of the rural clients.
Thank you, Tony. I appreciate that. Any final questions for Tony? All right. Thank you, Tony. I appreciate your presentation. And then was there anyone else that wanted to speak to any of their fact sheets or give a verbal presentation as well? Or had a slide deck that they wanted to present? Lisa, go ahead.
Yes, I do. Can I share a slide deck?
Yeah, absolutely.
Okay.
And sorry, I might have missed it, but hey, Isa, were you gonna present also?
Yes.
Okay. All right. Yeah, I wanted to make sure I didn't miss anyone else. All right. Great. All right.
Okay. How do I? Sorry, trying to manage two screens at once is a challenge sometimes. Okay, can you see that slide? Are you seeing my slide? Okay.
Yes, I can see it. Go ahead, Lisa.
Okay,
Thank
wonderful.
you.
Thank you. I'm Lisa Reams, and I'm here representing Pima Council on Aging. And I'm not doing an overview of PCOA because that's not what I'm here to do. PCOA serves as the designated area agency on aging. for all of Pima County, and that's designated through the Older Americans Act, which is a piece of federal legislation. So since the funding that comes through the SSBG stream is all related to in-home services and supports for older adults with case management, in-home services, housing, wanted to present from an area agency on aging view what we're seeing in the community related to those issues. So that's my goal in the next few slides. So starting off just with some urgent housing and basic needs assistance, and I think you'll hear a lot of the things that Tony just shared in here as well. So if you look at the helpline that we run for the community for older adults and their caregivers, and you go back a few years, the number of calls that came into our helpline that we would call urgent referrals, like urgent financial assistance, urgency, safety, housing assistance. I looked at stats going back to 2018. And you can see they hover in the 20 to 25 a month for a while. Then you see it jump up in 2021. This is right when we all started seeing more housing insecurity, more homelessness, more food insecurity with older adults. But 2025, those numbers started skyrocketing. So we were starting to see over 70 callers a month calling us related just to housing insecurity, emergency financial assistance. And I have to tell you, PCOA is not an emergency financial assistance organization. We're not a homelessness organization. So this was new. This was new in the 58-year history of PCOA that we became this place where people were calling for urgent help. For us, urgent is an older adult age 60 plus that's living in a situation without their basic needs met. It's either unstable, unsafe, they're in danger of losing their housing, they lack electricity, gas, or water, or it's being shut off, they're lacking food in their home, and they're unable to move to get into stable housing. So they haven't hit the homelessness network yet at this point. They're still in housing, but it's very unsafe or unstable, or they don't have their basic needs met. We suddenly became an emergency financial assistance organization. We started getting community donations. We started getting some city and county and state funding. It started to trickle in a little bit, and $10,000 or $20,000 here or there. In 2024, it was up close to $250,000. And between 21 and 25, we actually received and distributed over $900,000, helping stabilize living environments for over 1,100 people age 60 plus. This was new and unprecedented. Most of these individuals were the first time experiencing issues where they couldn't afford food or housing. And this trend keeps growing. We're very fortunate to have some state and local funding just to help with emergency housing and food insecurity issues. That's like one-time assistance. So one of the things we look at with Pima County is the population of older adults in Pima County is growing faster than that in the rest of the state of Arizona and faster than nationally. So it's up now to 27% of residents are older adults, and we see that number continuing to increase more rapidly than the state or national numbers. There's just a couple of things I ran across recently where that there's estimated that 85% of older adults cannot afford to pay for in-home care on their own or to move into an assisted living facility. So it leaves a number of older adults that are really starting to need help to live independently or to care for themselves without a really good avenue to get the assistance that they need. And then the state is acknowledging that people 55 and older are the group receiving the biggest increase in homelessness services in the state. So there's some pretty dire statistics around older adults and housing and basic needs. Talking specifically about in-home support, the trend I'm sure we hear from everybody right now is that funding for nonprofits is a very challenging prospect, and things are being cut. But funding was decreased for Pima County through federal funding, through the state of Arizona, Pima County received a decrease in funding, a pretty significant decrease in funding. If you go back to 2021, with our levels of funding plus with COVID stimulus funds that we had, we could actually assist 1,300 older adults in personal care, light housekeeping, grocery shopping, things that allow them to stay independent in their homes. The number has decreased this month. It's 720 people that we're assisting. And we have another 190 people that have already been cleared, screened, eligible on a wait list that could last more than a year. So that's just related to the funding decrease. We also, I didn't put this on the slide, but we've had to reduce the number of units that we can provide to help people, where for a while it was 6 to 8 hours a week we could provide direct care workers in people's homes, and now it's 3 to 4 hours a week. So the number of units has also decreased by 50%. Related to food insecurity, if you go back a couple of years, we had hit 1,232 individuals that we were able to help. These are homebound older adults who qualify for Pima Meals on Wheels. And due to the funding reductions, that's been cut more than in half, and we're currently providing meals for 596 older adults. None of these numbers mean the need has dropped. It just means the funding available to provide services for people has dropped. At the same time, the number of congregate meal sites was reduced, and from a high of 853 a month just a few months ago, we're now down to less than 300 people, older adults attending community lunch programs. We're actively working with community partners, just as Tony was saying, that we've got to all work together to try to solve these issues. We're working with community partners to try to increase the numbers of sites, the number of meals, and see what we can do to close those gaps. Eligibility for these services is homebound individuals need assistance with 3 or more activities of daily living. So that could be dressing, bathing, toileting, a number of different activities. And our services per federal legislation have to be prioritized for those in the greatest social and economic need. That means they financially qualify or they don't have other natural supports who can help them. So 60% of the older adults that we serve are under 100% of the federal poverty level, and 80% are under 150% of that actually might have just increased slightly. Almost all of them are under 200% of the federal poverty level. People ask, well, how does the SSBG funding fit into this picture? It currently supports about 3.5 case managers and all the associated program expenses to serve older adults and adults with disabilities. It pays for in-home supports for approximately 60 individuals a year, and it provides 5 home-delivered meals per week to approximately 35 individuals a year. It is also the only funding that allows services to be provided to adults with disabilities under the age of 60. That's what I got. We could share a lot more information, but I know a lot of those are pretty sobering statistics. So wanted you to at least see that snapshot of what we're seeing.
Thank you. Does anyone have any questions? Checking to see if any hands are up. Thank you so much for the presentation, Lisa. I see a couple hands. So not sure whose hand went up first. I'll choose Tom first, and then I'll move to Liz. How about that? Go ahead, Tom.
Sure. I mean, Lisa's statistics are actually spot on in what we see. I mean, they obviously deal with way more seniors than we do, but the amount that we have seen, the growth over the last few years of people being evicted, all of that has increased steadily. The other piece that's not in there is the amount of transportation that these people need to stay in their homes. There are not a lot of agencies that do that. SunTran is probably the largest one. I mean, I'm just guessing, although not super convenient. I can tell you that when SunTran drops people off at our food bank, even though we would be willing to allow them to get loaded first, they won't. They just drop people and they leave them for 2 to 3 hours. And I would suspect that's the same thing at their doctor's appointments or whatever. But if people are able to live independently at home, they've got to be able to go see their doctor. And if they don't, it just is a downhill slide. So it's one of the lacking pieces, I think, in Tucson, as far as getting people to where they actually really need to be. to be able to live independently.
Thank you, Tom. And then Liz.
Thank you, Lisa, for your presentation. I am wondering if there is data about co-housing or share housing for elderly. Is that happening, or are there plans for that to happen?
Such a great question. So we studied a number of national models and got some seed funding to explore a senior home sharing program a couple of years ago. And because there are some communities doing a lot of senior home sharing, and how it looks in these communities is an older adult owns a home and they might be house rich, but cash poor and need in-home assistance. So they end up with someone, whether it's another older adult or a younger person who moves into their home, pays them some rent or provides some assistance to them in return for living there. There were a number of reasons we weren't able to get that off the ground in Pima County. And there was a group called Tucson Home Sharing working specifically on that issue as well. And they also had to stop doing formal services related to it. There were a number, I could talk for an hour about it. There were a whole bunch of issues. Love to follow up with you if you have a particular interest in that area, want to talk more about it. So that was the model that we pursued, was the older adult homeowner and then having a home sharer that could potentially move in. There's another model that's done with younger adults frequently. That's more of a roommate matching model and to get into a shared apartment. And we've never explored that related to older adults.
Yeah, and I'll just chime in too and say that I think like TPCH is starting to try and explore some of that matching for the unhoused population to rapidly rehouse them. And I don't know if you know anything about this program, Lisa, but I think that ARC is still doing on a very small scale some kind of, I think they called it boarding house, but it was like shared housing.
They trained a number of, or provided education for a number of homeowners to basically be able to start up board and care homes where they could take in, 2 or 3 for older adults into their home and receive state funding to be able to provide assistance to those, like kind of an assisted living home, but not licensed. So there are board and care homes is a whole other issue, both a needed niche and an unlicensed branch that sometimes has some real challenges to it. So.
Thank you. Were there any other questions or comments? All right. So I know, hey, Isa, did I say it right this time? Close? Did I even get close?
Got it.
What's that?
You got it.
Oh, good. All right. So I know you had a presentation, but I thought perhaps, Lisa, did you want to do an introduction for Hayeza and kind of set the tone on, because I know there was a conversation in our last meeting amongst subcommittee members about a potential survey. And so I just kind of want to close the loop on that so everybody knows where we sit with that, but then also allow Hayeza to do the presentation. So
yeah, sure. I'm happy to do that. Yes, I did not do a survey. I'm sorry. I should not have committed to that. I left when the meeting was on like Tuesday, and then I went out of town on Thursday and I was gone for like 10 days. So that was dumb. But I didn't drop the ball completely because I did connect with Hayeza. We had mentioned that the Community Foundation of Southern Arizona had done a larger survey earlier in the fall, just kind of asking local nonprofits to weigh in on changes to their funding. So yeah, reached out to her to say, oh, I don't know, I haven't seen anything released, but if it's possible, would you be able to share some relevant info for the group? And very happy that she accepted. So we still will get some funding insight, despite me not following through. Sorry again. Okay, I'll stop apologizing and I'll hand it off.
Thank you, Lisa, and thanks everyone for having me. Can everyone hear me okay? Just double checking. Okay, perfect. So I'll be doing a verbal presentation. We are just now completing an initial draft of this report, so I don't have any slides ready, but I'll try to provide as much high-level information as I can. First, saying thank you to any of you who were able to participate in this survey and provide as much information as you could towards us trying to gather insight on what's happening specific to the region. There have been other surveys conducted throughout the year relevant to the entire state of Arizona. It was important to us to try to get a picture specifically of the Southern Arizona region, mainly because of the types of nonprofits that we have here in the region. Obviously, you've heard from previous presentations, our population is a very niche and specific population. There are certain issues that affect this region differently than they do statewide. So we did launch this survey back in September, recently closed it on September 30th. We had about 140 responses. The vast majority of those came from Pima County. And just to be specific in terms of what we mean by Southern Arizona, CFSA defines that as anything south of the Gila River. So that includes Cochise, Graham, Greenlee, Pima, Santa Cruz, Yuma, and portions of Pinal County, as long as it's south of the Gila River, as well as any tribal communities that are within those boundaries as well. So in terms of high-level things that we're seeing, for the most part, a lot of the respondents are tying shifts in public policy and funding cuts to increased demand. We did not get as many responses as we thought we would in terms of people saying that they have received direct cuts, direct reductions in funding, but that anticipation, the larger policy shifts, those conversations around DEI and changes in language to programming, all of that is leading towards increased tension, increase in demand. And obviously, there are things that are impacting the larger community, not specifically the nonprofit sector, that's leading into that demand towards the nonprofit sector. This is not news to any of you. You are working on the ground. You are seeing the firsthand impacts of that increase in demand, and you've been seeing it for a long time. Something that we saw during the pandemic, when I first started with the Community Foundation, is we anticipated that the pandemic would result in, direct funding cuts that would then lead to other problems that we needed to fix. And what we found is that the anticipation of the cuts, the increase in demand, sort of the withholding of funding and resources from both funders and donors who weren't really sure what the next steps were or what to do, that turned out to be a pretty large problem during the pandemic. Based on the results of the survey, I'm seeing a similar sort of behavior from funders and from donors and with nonprofits as well. So I'll talk a bit more about that. Just to give you a profile of the types of folks that responded, the vast majority were from Pima County, about 104 of those organizations. That was followed by Santa Cruz, and then sort of sparingly across Yuma, Cochise, Graham, and Pinal County. We didn't get any nonprofits from Greenlee. In terms of budget size, the majority of the nonprofits come from the range between 500,000 and under 2 million. The rest are nonprofits who are under that 500,000 range. So that's typical to what we see in our core grant round, which is our largest and most broad grant round. So that's kind of what we were expecting to see here. In terms of the focus areas of nonprofits that we've heard from, the vast majority are coming from organizations that have self-identified as serving basic human needs, followed by organizations serving children and youth. And then we also had a large representation from arts and culture organizations. That's not strange to the Southern Arizona region. We do have a pretty large population of arts and culture organizations as well. We also had some representation from organizations that are serving disability and adoptive services, education and early childhood education, as well as organizations that identified their primary focus area as advocacy. So a pretty good range of different types of nonprofits. In terms of population served, the vast majority of the nonprofits who, again, self-identified with this did say that they're serving general population. What we asked organizations to do were if they were not tracking a specific population served, or if their work goes very broadly across different types of populations, we asked them to select general. So not surprised that there's a majority there. But for the organizations that identified a secondary population, children and youth is pretty high up, economically disadvantaged people, Hispanic or Latino Latinx people, and then adults and people with disabilities were also high populations that came in. So again, this is not uncommon for the types of organizations that we see, especially in Pima County, which is the majority county that's represented. In terms of funding sources, 90% of the respondents indicated that their primary source of funding is private donations and fundraising. This could be individual contributions, grants from private or public foundations, or other forms of fundraising campaigns. The other highest level of funding came in as local, state, or federal government grants. So nonprofits indicated that there's a mix of funding sources. Again, you all are familiar with that. Service fees, earned income, local, again, state government grants, federal government grants, and then other funding sources like investment income and endowments. In terms of changes to federal funding, and I should be specific and say federal, state, or local, we did ask them to cover all three. Some nonprofits receive state, for example, grants, but not federal. We did ask nonprofits to state how much funding they anticipated receiving in 2025 versus how much funding they'd actually received at the time of the survey. The majority of the responses indicated that the amount that they anticipated is unchanged, meaning that they either received the exact same amount they were anticipating, or they were not anticipating any federal grants this year, and that obviously had not changed. We asked respondents to discuss or to let us know whether federal funding changes had affected their organization. 43% of the respondents answered yes, and 37% answered no. 18.6% or so responded that they were unsure. The purpose for asking this question in comparison to the first is that we understand that despite whether or not you may be anticipating a federal grant, shifts in the way that federal funding is happening, is being dispersed, withholding grant contracts, all types of things can impact a nonprofit, whether or not they are directly receiving this type of government funding. And for some more context on that, we had some qualitative questions that we asked, narrative questions that we asked nonprofits to expand on. Many nonprofits are discussing more competition in the funding space that they have not seen before. So organizations that were previously receiving government grants who may have had that impacted are now in the funding space with nonprofits who were more heavily reliant on those private individual contributions. And again, this is the opinion of the nonprofits that are sharing. We don't have proof that there's an increase in these types of organizations, but that's definitely a tension that we're seeing. Again, that increase in demand that I was talking about earlier is something that's impacting nonprofits, whether or not their actual funding structure has changed, which results in more attention on staff. Hiring freezes are something that is impacting these nonprofit organizations, along with layoffs. So I'll talk about layoffs a little bit more, which has also been shared in this survey. The majority of organizations did report no layoffs to date. However, many of those same organizations mentioned hiring freezes, unfilled positions, reduced hours, or sort of a passive downsizing rather than active layoffs. So while they haven't had to let go of any staff, there are key positions that haven't been filled, programs that can't move forward because they don't have AmeriCorps Vista volunteers or things like that. The Vista program, to my knowledge at this time, is continuing to be funded, but that uncertainty, that couple of months where we were trying to figure out what was going on, did result in some delays in getting vistas in place. The foundation definitely was impacted by that as well. In terms of those layoffs, we're seeing the vast majority of active layoffs within medium-sized organizations. So that's organizations with budgets at about 250,000 to that 500,000 range. The least layoffs that we're seeing is in those under 100,000 to 250,000 budget organizations. Larger organizations are definitely still impacted by layoffs. A lot of those larger budget organizations are organizations like the ones represented here, who have government-funded positions or government-funded programming that was impacted, especially earlier in the year. In terms of programming and people served, I will say on my initial, compiling of this report, this is really where we're seeing the biggest impacts. Staff shortages, lack of program coordinators, reduced capacity are causing program delays. There's some ripple effects where reduced support in one area is affecting the broader service quality of the organization. And then a lot of the respondents talked about general policy shifts. So not just policies that are impacting the nonprofit sector directly, but just larger policies across the country that are impacting vulnerable populations such as immigrants and refugees, LGBTQ plus individuals, low income families, women and children, and then of course rural communities, which rural areas make up the vast majority of our service region. So that was important for us to note. The scale of impact, when we asked respondents, what are the number of people that you anticipate being impacted by these shifts in your programming? It ranges from no effect to upwards of 10,000 individuals. So this is something that either, can be seen in really small scale or is something that is impacting organizations that serve across the different counties. In terms of other specific impacts reported by the respondents, again, reduced programs and services were a large portion of those impacts, increased demand, delayed growth, so an inability to either increase staff or increase the scale of programming, staff layoffs, and then difficulty fundraising was also an impact that was mentioned. And again, in terms of that fundraising, nonprofits are also expressing the concern about individual donors being a bit more hesitant to fund specific types of programming, funders being hesitant to support specific types of programming. And also, I will say from personal experience, we have had conversations with donors who aren't hesitant to fund specific types of programming, but are sort of unsure where they can help in sort of the vast scale of different things that are being impacted and need to be directed to specific areas, but are also kind of feeling like, well, if I give here, does that leave this huge gap in this other area? And what results is this sort of paralysis instead of moving forward. So a part of this survey was for us to be able to provide that data to our donors as well, to get them a bit more encouraged in terms of moving forward. Talking a little bit more about programming and the kinds of people served, many of the programs mentioned that are being impacted, again, food and basic needs, housing and emergency assistance, youth and education, especially as it relates to after school and summer programs, transportation, especially no-cost transport for seniors, transport in rural areas and medical visits. Tom, you mentioned that before. Healthcare and mental health, legal and immigration services, and then workforce development was also mentioned. We got a lot of good narrative feedback from these organizations who, very bravely and honestly expressed to funders, to government officials, and anyone else who will be a part of this audience, what is it that they want us to know about next steps moving forward. General operating support is being propped up as, something that is immediately needed. Obviously, you need the flexible funding and the autonomy to decide where that funding goes and how soon it needs to get there. And then in terms of other types of support, nonprofits express needing support with education and advocacy. So anticipating that, funders are in a position of power as well as government officials to work on the policy side of this and to advocate for the larger sweeping issues that are impacting the sector. Support with preserving funded programs, smoothing short-term disruptions, and then another mention was shared services and wind down support. So some nonprofits are actually looking for support with collaboration, coalition building, things like that, which there are some opportunities for that in terms of Arizona funders. We also asked about capacity building needs. Nonprofits were asked to share what their top capacity building needs would be. As you know, CFSA's Center for Healthy Nonprofits serves the Southern Arizona region in terms of capacity building. Some of the top mentions, of course, were fundraising and development, grant writing, communications and marketing, and then strategic planning. There were some other mentions for board development. And then something interesting that came up was the amount of mentions of staff experience in terms of staff well-being, burnout, things that nonprofits are seeing sort of internally that don't always have a direct solve or a direct solution in terms of grant funding. So again, this is a very initial report. It's still being reviewed internally, and there are some other questions that we're hoping to try to answer through this. But for the most part, nonprofits were very clear that whether or not a specific funding cut has happened to them as yet, there is that fear, that tension, that anticipation that that's something that's coming. The increase in demand in services is still happening, whether or not those funding cuts have impacted them as yet. And they want funders to know that continuing to provide things like general operating support, being more flexible with the structures around grant making, and then also providing capacity building support that is relevant in this current time and beneficial to organizations is what's going to be needed at this time. So obviously we won't solve all the questions with this initial report, but hopefully it provides more of a clear picture of what's happening in Southern Arizona specifically. And again, to any of you who have completed the survey and took the time to provide that information, we are very grateful for your help in this. So I'll pause here. I know that was quite a bit, and feel free to jump in with questions and I'll try to answer them to the best of my ability.
Thank you. Any questions for Isaac? Oh, got a couple questions. Liz and then Tom.
Thank you, Isa, for the presentation. I'm wondering if the end result would be presented by county, or is it, I know that you mentioned all of the counties that were surveyed, but at the end, would the report be by county or all together?
This is going to be all together for Southern Arizona. We will probably insert some additional information for counties such as Santa Cruz, because that was the second highest represented. There were not many responses from the other counties, but we'll try to include that information as well. And then just to add, in terms of where this information is going to go, CFSA is going to release a version of this report. We're also in discussion with Map Dashboard to figure out a deeper dive into this data in combination with data that Map Dashboard has in terms of nonprofits in the Southern Arizona region. So you can expect additional information to come from this, aside from just CFSA's publication of the report.
Thank you.
Go ahead, Tom.
Thank you.
So
And
this
then
is great.
Tom?
I filled it out 40 times, so I've kind of stuffed the ballot box, but no, I'm only kidding. I'm just wondering, the discussion about the competition between nonprofits, is CFSA looking at that at all? Because there's such a diversity between the small ones, the larger ones, and really who has the infrastructure to actually help. In some cases, I belonged on 3 different community review groups that look at funding, and the groups always choose those in most need, but maybe won't have the largest impact. And they see organizations that have 2 million or 5 million or an endowment as, well, they're fine. Except the reality is that those organizations will probably be around in 5-10 years and maybe have the infrastructure to help more people for less of the cost. And I know I've talked about this with the Community Foundation. You have the core grants, and if you're less than $1 million, I think it's $1 million.
2 million is the
2 million. But if you're over 2 million, you can't apply for those at all. So it's just, I'm wondering if anything came out in that kind of component. It didn't sound like a lot of organizations over 2 million filled out the survey either.
Yeah. Yeah, there was a smaller percentage of organizations above that $2 million range. And I will say that response in terms of the increased competition in seeking grant funds did stand out to us. We haven't had a conversation yet in the context of this survey as far as the different budget ranges and how those types of organizations are being impacted. But I can say that it's coming up more in terms of the core grant round and that $2 million threshold, whether that needs to be changed. Obviously, I'm no longer in that position over the community impact team to say whether or not that'll happen. But what we're noticing is that funders are, like you said, hesitant to support larger budget organizations, assuming that 2 million or over means flexible funding, means the ability to adapt and shift and make changes as needed, when that is really your operating budget. That's what you need to sustain and maintain the programming that you already have, which means, of course, you need additional support. So it is a conversation that's happening internally at CFSA. I can't speak to where it's going to go, but the fact that it was mentioned in this report, I think is going to be important and a part of that conversation as well.
I'll just add that to your thought. It's an interesting thought about nonprofits maybe merging or finding pathways to work better together, because the competition is everybody's supporting eviction prevention or this or that. It doesn't. The infrastructure is already in place with some organizations, and other places are trying to build it, and that's costly.
Yeah, I will say that the Arizona Together for Impact Fund is structured to support those types of mergers and helping to build coalitions as well. They provide exploratory funding for working with a consultant to support that kind of work, along with implementation funding. I did serve on the governance committee for the last about year and a half, and the amount of organizations that do approach the fund from Southern Arizona is much less than the organizations approaching in terms of mergers from like the Phoenix and Northern Arizona area. Christine Thompson did come out to Southern Arizona and make a presentation on the opportunities provided by that fund. And I think she'll be more present in the region to try to speak to nonprofits about that opportunity. It's not something we like to talk about in Southern Arizona from what I've noticed, but it will be necessary for many organizations in the new environment that we're in. That's just going to be the reality of where we are, I think.
Great. Thank you so much.
No problem.
Then thank you, Tom. I see Lisa's hand up. Go ahead,
Yeah,
Lisa.
I was just going to chime in on that note. It sounds like it didn't come up as much in this survey, but last week I was at a National League of Cities conference, and a lot of the people from other cities were asking who else had been seeing this trend of nonprofits like shutting down and really only having a smaller and smaller pool of only really large nonprofits to support. So I don't know if it'll play out differently here. I feel like I haven't heard that a lot here, but that definitely seems to be kind of the trend that I heard from other metro areas.
Yeah, I know that Alabama has also, and the name of the organization in Alabama is completely escaping me at the moment, so I apologize. But there is a similar foundation in Alabama that released a similar survey to this and is gathering that type of data. We did also talk to the Community Foundation for Northern Nevada about a survey similar to this that they released, and all of them are doing this for different reasons. In Nevada, it's for them to build out more capacity building for nonprofits. In Alabama, it's more so to understand the funding landscape. But I'm curious to see, with all of this data that's being gathered, how the different nonprofits across regions are being impacted in comparison to Southern Arizona, where we have such a high population of nonprofits per capita. So we'll likely see a lot of nonprofits being impacted by closures, mergers, things like that, but it may also tie to just how many nonprofits exist in the region. So I'm curious to be able to compare that in the future. Any other questions?
I was just curious if, to Tom's point, I believe it was you, Tom, that talked about the different thresholds, like above 2 million versus those that are below that. If there was any discussion about kind of the breadth, if you will, regionally, in those two tiers, if you will, of how many people they serve. Let's say you're in the 2 million plus bracket, urban versus rural, and then same with the smaller entities, because sometimes what you can see is a lot of smaller entities, such as Green Valley Assisted Services, really making an impact in rural. And I was just curious, what is the compare and contrast? You know, is there a lot of large organizations also serving rural, and how does that go into the survey? And then the last piece is, you know, you said there's certain topics that not everybody wants to talk about, and you know, we're kind of shining a light on some of those a little bit right now. But you know, in lack of a better word, maybe not merger, but maybe like coordination or linking arms. Like, yes, we'll apply for the funding, but it's understood that here's how we're going to work together as two separate entities, kind of linking arms, so that we can reach more people. And here's where we win because we have like stronger infrastructure in this space, but you have a skill set or a capacity in another space, and I think we're a good fit. Is there either currently or in the future an intentionality to kind of see where there is this opportunity for organizations to link arms and perhaps reach more people through the benefit of large organizations that have that infrastructure in place, and small organizations that are doing great work but could benefit from linking arms with those with larger infrastructure?
Yeah, I think that there's definitely opportunity to start that conversation at the very least. I think for CFSA, one thing that will come of this is the opportunity to convene organizations to discuss the results of this survey and what is the initial response that you have, what comes up, what are the concerns, what are some options that we might be looking at. Funders are not going to be able to fully fill this gap caused by the federal funding cuts. But I think the least that funders can do is create the space and provide hopefully some of the infrastructure for these types of like coalition building conversations to happen, right? Bringing in people like Arizona Together for Impact to be present in those conversations. In terms of the variations by like budget size, people served, county, that's something that we're still planning on diving into in this data. We did ask a lot of questions in terms of people that we anticipate being impacted by the funding cuts, not so much who are you currently serving. But I think there's ways with the data that we currently have to try to paint a picture by budget size and by county. Where are we seeing these impacts the most? And then what can funders and government officials learn from that information in terms of the services that they're trying to provide? So we can definitely put some more information about that in there.
You. Right. Okay. I think that concludes all the presentations and perhaps the questions related to the presentations. I'm not missing any other hands up. All right, we're going to go ahead and move forward. Thank you so much for your presentation. That was a gift to all of us because you put a lot of hard work into that, and so I really appreciate, especially doing it somewhat, short notice, I guess, comparative to everybody else. So I really appreciate that.
I want to say that Lisa did not fail. Actually, this was great, Lisa. It was better than a survey. Nice job.
Yeah, I think it was great.
Thank you for having me. And thank you all for all of your presentations. I also learned a lot, and don't be surprised if you hear from me or someone else from the foundation trying to find out more. And yeah, thank you again.
Yeah, thank you, Lisa, because you really, once again, over-delivered and allowed for more great people to be a part of this discussion and provide these presentations. So thank you so much. All right, so we're going to move to the next item on the agenda. And this is the regional needs discussion. And so we're in a posture where we need to be mindful of things that you've seen in previous emails from me in terms of when we set the stage for doing the presentations and serving up any information, whether it be through a fact sheet or what have you, was that, this committee's obviously discussing local issues and trends to determine local priorities, right? And so all of us are wearing a hat that's going to lead us to making recommendations for service categories, not specific agencies. And so just as a reminder, the subcommittee does not review any applications, reports, or has or does not have any input into the state process once the plan is approved. So I just want to kind of do a quick recap on that. And then, of course, we're not advocating for any one target group, whether it's through our presentations or what have you. We're committed to having a regional perspective and a regional view as we look to make the funding recommendations. So I think what might be helpful, and I don't want to put Lisa on the spot. Prom, did you have your hand up? Did I? Okay. What might be helpful is for us to put back up on the screen the funding and service intents. But before I did that, I didn't know if Lisa, if you thought it would be of value to do a refresher on that original discussion tool that we had in our first meeting as just like a quick recap or not. I don't want to put you on the spot, but I just really respect your perspective on that because you did all the heavy lifting on putting that together for the committee. So
Yeah, I'm happy. I have it pulled up so I can share it
Okay.
really quickly. I know
All
maybe
right.
one or two people weren't here last time.
Right. Yeah, I just want to make sure everyone's kind of on the same page.
Let's see. It's very small. And I don't know if it ended up getting sent out to everybody. Hopefully
Well,
you all had a
so-
chance to look at it.
We do have another version we could put up that might show, I can ask my team to put it up, that might show it a little larger. The only negative to showing the one that we can put up is it doesn't let us play with it because it'll be like a static PDF version, but would allow for perhaps greater readability. So if we can have some flexibility in kind of talking through it as a recap through the PDF, we could do that.
I think this works, and I'll just go through
okay.
it really quick.
Okay.
So yeah, what we had done last year was I hid these columns, but we had looked at a few community assessments that had taken feedback from community members about what their priorities were. And we looked at the Prosperity Initiative, which took input from, I think, like 750, 800 community members. The Cooperative Extension Needs Assessment, as what their overall one, as well as these two smaller subsets that focused on health and well-being and economic development. And also looked at the City of Tucson P-CHIP tool and assigned points on how often the SSBG funding areas showed up in those results. And for categories that had two or less points, those are down here in orange. Oops, I was trying to hide that, sorry. No, I'm going very quickly probably. Then those were just kind of blanket recommended to have a slight reduction. If they were 3 points, they showed up in 3 of those assessments. We recommended keeping their funding the same. And if they had 4 or 5 points, we took the money that was cut from the bottom part and redistribute it to those areas. I think if I'm remembering, the ones in red were ones where the state did end up taking our recommendation. So we had recommended changes to 4 of the categories, having an increase, and 2 of them ended up getting an increase. And then we'd recommended reductions for 5 of the areas, and the state did reduce 2 of them. The reductions overall were really, really small. I mean, I think the changes altogether, it was just kind of moving around $27,000 or so out of the 1.4 million. And so I had just put together for this year kind of the same, and I think these were the numbers we ended up with last year. So if we kept it all the same in the same scoring for this year, these would be the changes. But I mean, I think we just heard a lot of information that, you know, we might want to consider distributing things differently. This was kind of just meant to be a starting point for conversation that was based on those community assessments. So yeah, hopefully that helped remind everybody what the plan with that was.
Thank you. I appreciate that. All right. So if we could go ahead and put the, I'm going to ask my team to do this real quick. If we could go ahead and put the funding and service intents spreadsheet up on the screen for state fiscal year 27. I know everyone received a copy of this. We are not necessarily going to go through it line by line once it comes up on the screen like we did the first meeting. So I know as we lean into making these recommendations, all the things I said a moment ago, we will be cognizant of and be mindful of as we approach making recommendations. So just for simplicity, if you will, and make sure everyone's on the same page about recommendations. DES does not necessarily give us a specific definition of what is meant by a recommendation, meaning they don't explicitly state we have to make a recommendation that says we want to move X dollars from one space to another. A recommendation can be that. A recommendation can be a percentage from one category to another. A recommendation can be simply that based on what we see in the region, we anticipate a need in funding by X percent for these reasons in these different categories, and allow the state to take those particulars into consideration as they decide what the allocations will be. So we as a group, we can be very intentional and mindful about how we want to approach making the recommendations. The tool that Lisa had put up and walked us through just a moment ago is the tool we used last time, and it was very helpful. And much like Lisa said, the amount of money that we actually did move from one category to another was a very small amount relative to the roughly $1.4 million that is part of the social services block grant. And for those of you that are familiar with this block grant, the amount of money that is allocated each year typically doesn't change much. It doesn't change much off of that 1.4 million. So given all the presentations that we've had today, that's something to be cognizant of. And so we're just going to start with the first tab. I think that's probably a good place to start, going from left to right, which is the Department of Child Safety. And I'll just kind of go through the three, and we can just take a quick look at that, and we'll go to the next one, and then we can perhaps refer back to the tool that Lisa just had up, and start the conversation about what we think the recommendations might look like, or what we want to discuss more specifically. So for the Department of Child Safety, you'll see that there's the supportive intervention and guidance counseling for both adults and children, and then the AFC, and you'll see behavioral therapeutic activities. And for state fiscal year 2027, you'll see the respective amounts of that are listed there: $34,602, $182,427, and $69,003. And so you'll see the total amount for the local plan level at $286,031. So that's for the Department of Child Safety. If we move to the Department of Aging and Adult Services, which is the next tab over. I'm sorry, I said department, I meant division. Division of Aging and Adult Services, you'll see home care for elderly adults, which includes the personal care, housekeeping, home health, a lot of the pieces that Lisa Reams and others had spoke to, the case management and the home delivered meals. State fiscal year 2027 local plan level is $782,533. And then if we move to the next tab, which is Child and Community Services Division, CCSD. There's a longer list here, so I'm just going to briefly review them, but supportive and intervention guidance counseling, both for adults and children, crisis intervention, shelter services, case management, legal assistance, and there's a variety of different categories, which we covered in the previous meeting. Emergency shelter, which I know we also discussed briefly today through presentations, and housing support services. to include preventing homelessness. And at the state fiscal year 2027 local plan level is 289,330. And then for the next tab, Workforce Development Administration, which is employment services for adults, meaning any individual 18 years of age or older. The state fiscal year 2027 local plan level is 39,538. And then for the
And
next
I'll
tab
note
over,
too that that's
Sorry.
the only one that they recommended a change over last year's funding. So that one, all the other ones are kind of flat, but this
Yes.
one, the state was recommending more money.
yeah, thank you. That's good observation. They did increase. It was the only one that increased by $2,835. And then for the last tab, Rehabilitation Services Administration, RSA, this is the one that Kim's team spoke to about interpreter services for deaf adults, and then supportive intervention guidance counseling for hearing impaired persons. And you'll see that the funding level is flat, right, from state fiscal year 2026 to state fiscal year 2027. But the amount is 57,195. So wanted to kind of walk through that really quickly so that everyone kind of has a quick refresher as we lean into making the recommendations relative to what we've learned through the different discussion tools and the presentations today. So if Lisa, if you could be so kind and pull up the discussion tool again, I think that could be helpful. And I'm just gonna, ask my team to take that down, but they already did. So if we wanted to, Lisa, I'm just going to let you, since you're driving it, I'm going to let you kind of talk through the different pieces and kind of.
Yeah, thanks. I was
school of
talking and I
thought.
was
Yeah.
muted. I was just saying that all the amounts we were just talking about that are recommended for this by the state for this coming year are in this column. And if they're red, just noting that that's an amount that we had recommended last year that they are recommending to like keep flat, at least for those two. And yeah, they're recommending an increase for this workforce one. They had taken our recommendation to decrease it last year. So they're still boosting it up. And I think they're actually going beyond maybe what it had been. It had been 41,000. We knocked it down to 36 last year. And now they're recommending to boost it back up to 39. So not the full like 41 that it had been, for whatever that's worth.
So the interesting thing in all of this, it's all numbers, but no impact.
Mm-hmm.
So how many people are impacted by the dollars that are going to those programs? And all of it's important. Don't get me wrong. But I can't, so I'm making like judgments based on, we want to give them more money or we want to leave it flat. Yet I don't know, did they succeed? Did they impact more children, more seniors, or whatever? Then the second piece I have is when I look at the state of our senior, our aging community, they are super hard to raise money for. It's not an appealing group for whatever reason, right? But everybody wants to give towards kids. So I just wonder, is there a give and take in that as far as what's easier to raise money for externally than in this case?
I see Carolyn's hand up, and
I had a similar thought. Oh,
go
sorry.
ahead. I'm sorry. No, I was gonna call on you, Carolyn, but I was just wondering if Hayeza had any thoughts on Tom's comment about donors perhaps being more willing to donate.
I think she left
programs.
actually.
Oh, did she? Okay, sorry. Oh, well, then never mind.
Did I make her mad? I'm sorry.
No, you're good. It's fine. That's my oversight. I apologize. So Carolyn, go ahead.
Yeah, I think just to kind of echo what Tom was saying, especially considering that we're supposed to be coming at this from a regional perspective, the aging population is growing as well. And I think more older adults are moving here from other places. And so I don't know if growth of population of different demographics who may be needing services is something that we should be thinking about too, kind of to echo what Tom was saying.
Do we have any thoughts on that? I see Liz's hands up. Go ahead, Liz.
I know during the last meeting we did discuss, and I think I asked a question. I think, Tom, you were saying, I asked how is the budget versus the actual and what happened and how do we have that data? And I know you were going to ask those questions. And I apologize if I missed the email with the answers.
No, you didn't miss an email. So I did reach out to the Department of Economic Security, but unfortunately I did not get a reply for that particular question. So I'm still waiting. I was hopeful that I might have had an answer before today's meeting, but I'm going to check my inbox right now. So I don't want to be inadvertently lying. So, but up until the time I started this meeting, I did not have an email from them. So I will check right now, but.
And this is my first time attending this committee, and I'm wondering, do we know, and maybe it was said the last time and I missed it, how do they come up with those recommendations? And like, I know that there was an increase on one of the lines. Do we know why they increased that? And like, what is their thought process for doing that?
That information was not shared when they provided this particular spreadsheet to us.
Yeah, I'm not sure, but and sorry, I don't have a way to raise my hand, I guess, because I'm sharing my screen. But I do think it's interesting because from what I've heard, and at this conference last week with the National League of Cities, they had one of their federal policy people there, and he was kind of saying that they expect, more funding for workforce development types of activities, economic development things moving forward. I mean, I still think that, and especially from what Cassie shared, it has gone down, and I don't know if it would be enough to make up the difference from what it was a couple of years ago. But to me, it sounded like that was maybe a priority, and maybe we're already seeing it kind of at the state level.
Thank you, Lisa. I'm having a conflict here in recommending changes when I feel like I don't have all of the information. So I'm just going to see what everybody else is. But I do want to ask, we're going to be here next year because I think we were here last year, even though not all of us who were part of the committee. Do we follow up throughout the year? Do we ask, do we follow up on the questions? Do we ask on this process? Is that an ongoing conversation, or do we wait until it's time again to have a committee and do this voting?
Let me make sure I'm understanding your question correctly. So each year in advance of the Social Service Planning Subcommittee being formed, DES will send over the funding and service intents, and then they establish kind of like a deadline in which they want the recommendations to be served up. And then we follow our process for following, incorporating a subcommittee, the public comment period, et cetera. So once this subcommittee, serves up recommendations, it will go to public comment period, and then it will go to our regional council for their approval, and then it will get served up to the Department of Economic Security. So a subcommittee such as this will not necessarily form again until DES serves up the funding and service intents for state fiscal year 28. So it's typically do this once a year.
And this subcommittee could be different every year, right?
Correct.
Based on who says yes and who says no.
Yes, we send out
Right.
we cast a very large net and asking for people to be a part of the subcommittee. And everybody has, different time commitments and bench strengths and willingness to participate. So it does change from year to year. Folks that serve on the subcommittee. And sometimes we have a lot of the same people, but oftentimes we also have a lot of new people to the subcommittee, which is good as well. And I think I see Lisa's hand up.
Yeah.
Sorry, Lisa.
One question that I know I don't think we would get an answer in time, but maybe like for next year or something, is I'm really curious about if all the funding ends up getting used, just because the way that the process was described, it sounded like similar to like earmarking funding, kind of, where the funding's like set aside and then organizations can apply for it. And I'd just be really curious to know, like if all of the funding ends up getting sent out to nonprofits, let alone, getting the information kind of about the impact. And then if it doesn't, kind of what happens to it.
Yeah, those are definitely questions I can write down and see if we can get that kind of information, especially for next year, like the state fiscal year 2028 funding and service intents, because I think that would be helpful for those discussions as well.
I don't know if this is something that would be allowed. Potentially having someone from DES like here to answer some of those questions, is that something that we could do? I mean, I know this is supposed to be the last meeting and we have like 20 minutes, but just thinking for next time, what would be helpful is having someone who can answer those questions in real time, because that would reduce you having to go back and forth and then would make it more efficient, probably. Just a suggestion.
Sure. Yeah, I can ask if there's anything that says that they can or cannot participate, but also if they have the willingness or the capacity to participate as well. So yeah, I think I see. So I wrote that down. So that's a great question to ask. And then Cassie, I see your hand up.
I think that's going to be Mary Fleck. She's my counterpart at the state vocational rehabilitation portion that deals a lot with the disabled individuals. Mary?
Yeah, so it was me raising my hand. So I do work for Rehab Services Administration, and there definitely is that need to have the funding for interpreters for any type of emergency services, because as part of vocational rehabilitation, we will pay for the interpreting for any type of employment situation, but we don't necessarily pay for it for emergency services. So there's definitely that need. And just as a side comment, there is a shortage of interpreters, not only in the state of Arizona, but also nationwide.
Oh, okay. That's good information. Thank you for sharing that. And Mary, was it Mary Fleck? I want to make sure I have your name listed correctly for our attendance. Did I say that correctly?
Fleck.
Okay, great. Thank you, Mary. I appreciate that. Right. Okay, so I think Lisa, you still have your screen up. I'm going to go ahead and let you kind of go back to where you had left off before all these. Well, we took a moment to kind of talk through some questions and concerns that people have, and I wrote the questions for DES, especially for next year.
Well, yeah. So I mean, I think right now, kind of, I've heard three maybe paths. One would be just to stick with the recommendations that the state had put forward, which is the numbers in this column L, since we've heard, there is kind of a lot of need from all of the areas. And maybe we don't have enough information to make an informed recommendation to change anything. The second one would just be to kind of stick with the way that we did it last year, since a lot of those community assessments are still relevant and holding. And if we wanted to still try to put a little bit money towards some of those 4 priority areas, and reducing really slightly some of the other ones. But then also I heard some things about maybe having older adult services have a little bit of extra money. I mean, one way we could kind of think about doing that is like adding an extra point to certain areas that we thought should get additional funding, and maybe less for, I don't know if it would be like the youth services, since we haven't heard as much about the need for that, and does seem like maybe those programs are being still funding, not having as dramatic changes to them, and possibly the workforce one. But that would require just some kind of updated calculation maybe to take into account that feedback from today.
And then I see Cassie's hand up. Go ahead, Cassie.
Yeah, I'm after looking at all of the recommendations, the state budget, and I know just having spoken with my network locally, I kind of feel like we should just leave the recommendations as is without making any changes for now, just because of what's coming down the pike for sure until 2027, if that makes sense.
Yeah, I'm putting my hand up and I'm going to jump in. I actually, when you articulated that, I think that that is a really important point, just to not cause more disruption, maybe, to have something that is at least consistent that people can plan on, since there are going to be so many other funding sources that are up in the air.
I don't disagree, but I disagree a little. I think we know that the senior problem, the senior age people will be more of a challenge coming up, and there's no amount of funding that's externally gonna change that. Where I think that even if something happened in the children's area, there are public donors, I think, that would come forward to help with that. So I don't disagree leaving it to give stability, I think, to give some confidence that some things won't change. But I do think that our older adults are going to continue to suffer at a greater pace than much of the community.
I'll just jump in. I mean, I definitely agree that there's a crisis with older adults right now, no doubt. And that though every organization is feeling, and every population is feeling a squeeze right now, the older adult organizations and populations are, I believe, feeling it more. At the same time, I think there's a lot to be said about stability in this funding source right now. And $3,000 to $5,000 is not going to make or break older adult services right now. $75,000 would make a difference. $100,000 would make a difference. $50,000, but three isn't going to make, I mean, that's not going to make or break something right now.
Lisa. I thought I saw someone else's hand up, so Tony,
yes.
go ahead, Tony.
Oh,
sorry.
No, go ahead, Tony. Then I'll go.
I just want to say I wholeheartedly agree with Lisa, and leaving this as it is. You know, we all continue to look for other sources of funding, and this is one that where it's at, it helps as it is someone. And $3,000 isn't going to make or break us. So it's not worth arguing over.
So I just want to make sure I'm hearing it correctly.
And I think Liz still wanted to say something too.
Sorry. Go
No,
ahead.
you're fine. Yes, I do agree on that. But I do want to make sure that and I don't know if this is possible, Janine, when we submit or when you submit the recommendations, that there is the list of all of the points that we discussed, that it is written down somewhere and it becomes official, that this is what was requested for next year. Because I think, so not hearing maybe, and I'm not sure that we invited any of the youth organizations to do any of the presentations. Not all of the organizations are here. The data is not anywhere to be here so that we can see the impact or not. The budget versus actuals, like, oh, I think we're missing a lot of information. And to make any recommendations. So that's the reason that I'm saying I think we should just leave it as is and recommend, but making sure that we also recommend that for next year, this is what we need before the committee or subcommittee is formed. That would be my recommendation.
Then also if DES would be open to sitting in to field any questions that came in.
Yeah.
Well, I also think maybe having 2/3 of this committee return, getting those commitments ahead of time so that we have some consistency in thought. And a lot of this group is actually the same as last year, which is wonderful. You just hate to see that go away.
Mm-hmm.
I mean, we've taken huge strides with this spreadsheet that Lisa created last year. So, I mean, I absolutely love that we're moving forward.
Mm-hmm. And then Cassie, I think I still see your hand up, but I'm not sure if it's back up or if it's just still up from before. So I want to make sure I'm
back up.
okay.
I wanted to
no, you're
add
good.
to
I just want to make sure
for next year. I think it would be important for us to also get what was removed at the federal level, what the state is going to fill in and budget for moving forward. I'm not so concerned about youth or DCS right now compared to next year, or, with the issues with Title I funding and DSEG monies through the districts. I think that a lot of this stuff is going to shift as far as priorities. And it has a lot to do with what's going to come down with the federal budgets. And so it's important to see how the state navigates that, because obviously it's trickle down, right? So whatever the state does is what all of our organizations are going to be able to support moving forward, and like, just to make a point, the $6.2 million that I presented in our workforce silo, that includes the community-based partners that we contract with. So that's funds to community-based organizations to support workforce. Same thing with, housing and homeless services and all across the board. And so when we don't have the money, we don't have as much to contract with and to send out into the community to organizations, but we still try to maintain that level of service. And I think that it'll be really telling for next year to see how the state pivots and really what holes are left, and what we need to do locally to help drive all of the good work that everybody in this room does.
Thank you. And then I see Lisa, your hand's up.
Yeah, I really appreciate that. And yeah, Cassie, you should come back, because it sounds like you have a little bit of a handle on some of that too, and a good overarching view. But I wonder if, kind of to everybody's point, maybe we try to have like 1 or 2 earlier meetings also, just to kind of set up like what the plan would be, and really commit to like what the structure and the things that we want to make sure that we do, and the information. I mean, we have some things right now, but at least to maybe check in, like, I don't know if it'd be near the end of the summer, so that, we can like stay on track and know which presenters we want and if they're going to cover what we need, all of that.
I think those are good points of consideration. So what I'm going to ask, if I could be so bold to ask, is if you could send each of you that brought up these great points, if you could just make sure that you send me an email articulating it in the beautiful way that you did earlier, so that my quick, transcribing of your thoughts is accurate. Obviously, this is recorded, so I can capture it that way too. But it's just always good to have it directly from the person that provided the suggestion. So this way, if I need any clarification, I know who to email back and ask those kinds of questions. So that would be helpful to me if I could be simple to ask that. So on that note, I did make a list of all the things that people had shared, but when I get your emails, I'll, double, triple check everything. And then we can kind of set the stage for how to do this perhaps a little differently for the next state fiscal year funding and service intents. But for this one at hand, what I've heard so far is that given everything that's been discussed, the thought at this time is to not make any changes to the funding and service intents for state fiscal year 27 as it is outlined by DES currently. Is that what I'm hearing? Is that kind of the general consensus? I see some heads nodding.
Yeah,
but
yes, for me. Yeah.
Pardon me?
Yes, for me.
Okay.
Yes, for me.
Also
Is
agreed.
Okay. Is there anyone that is not comfortable making a yay or nay? And that's okay. I just want to make sure I'm respectful to everybody having a voice in this process. So, or is there anyone says like, no, I'd rather make a recommendation? Just want to make sure I'm capturing everyone's thoughts on this. Okay, so by a show of hands, maybe like the virtual hands, how many people are comfortable with, they live with the idea of or the recommendation being to leave it as it is written by DES as it was served up. I see 3, 4 hands up. All right. Okay, so we definitely have the vast majority of the people on the call saying yes to leave it alone. Okay. All right. So with that, I'm going to say that is the recommendation as of today. That recommendation will go out for a public comment period. So people can provide a comment during that public comment period. And then with that being said, I'm going to go ahead and move it over to the next item on the agenda. And so if my team can bring that up. Oh, well, I should have went to that slide. So my apologies. That was what we just covered, was making the recommendation. And then the next one is adjournment. So first and foremost, I am so grateful to every single person that has served on this committee, both for the previous meeting and this one, because I recognize the investment of time that it takes to commit to this, the prep work, whether you did a presentation or just being mindful about how to participate well in the discussions. I appreciate everyone's feedback. Much like Tom said, we are moving forward in terms of improving this every single year. And we appreciate those that are consistently volunteering to be a part of the discussion. And we're so excited that more people are being a part of this discussion, because that's how we really are able to hear all the different voices about the regional needs and can make sound recommendations for these funding and service intents. So I appreciate everyone's commitment to this and their hard work. And, thank you again to Lisa, because Lisa Florin put so much work into that discussion tool and really has been my wingman, so to speak, in terms of helping to invite more people to be a part of this subcommittee. So I'm very grateful to her. So if you get a chance, say thank you to her as well. But thank you to everyone for being a part of this. So thank you for your time. It is 3:58 on October 21st, 2025. So we finished 2 minutes early. So I think we can celebrate that, right? We didn't run long on a meeting. So, all right. Thank you, everyone. Have a great rest of your day. And I appreciate all that you do. And please send me that email with the recap. Thank you.
Bye. Thank you.
Thank you, everyone.
Thanks,
Bye.
everyone.